Disruptive conduct in the healthcare workplace is more than just unpleasant behavior, it directly undermines patient safety and the quality of care. When individuals engage in intimidation, bullying, threats, or humiliating actions, it creates a hostile environment that impairs communication and teamwork. In a laboratory setting where precise coordination and clear communication are essential to ensure accurate specimen handling and timely reporting, such behavior can lead to errors, delays, or compromised results. Histotechnologists rely on collaboration with pathologists, clinicians, and other laboratory personnel, so a culture of respect and professionalism is critical. Every healthcare worker has the right to a workplace free from disruptive conduct. This right is supported not only by ethical standards but also by workplace safety regulations and organizational policies designed to promote a healthy work environment. When disruptive behavior goes unchecked, it discourages staff from speaking up about concerns, including potential patient safety issues or procedural mistakes. This silence can have serious consequences, especially in histotechnology, where vigilance and attention to detail are paramount. Creating a professional culture that protects and encourages open communication is essential. Leaders and supervisors must actively address disruptive behavior, providing clear expectations and consequences. Employees should feel empowered to report incidents without fear of retaliation. In addition, training on conflict resolution and effective communication can help mitigate tensions before they escalate. In summary, disruptive conduct harms not only individual employees but also the patients who depend on accurate and timely laboratory results. Maintaining a respectful and supportive work environment is a shared responsibility that ensures the laboratory functions safely and effectively, ultimately safeguarding patient care. Histotechnologists occupy a critical position within the healthcare system, even though they often work behind the scenes. The specimens you prepare and analyze are foundational to accurate diagnoses and effective treatment plans. Because of this, the legal and ethical responsibilities you bear extend far beyond the technical aspects of staining slides or operating equipment. You are custodians of not only physical tissue samples but also sensitive patient information that must be handled with strict confidentiality and integrity. Your role directly impacts patient safety and the quality of care, even if you do not interact with patients at the bedside. For example, accurate specimen labeling is essential to ensure that test results correspond to the correct patient. Mislabeling or mishandling specimens can lead to diagnostic errors, inappropriate treatments, or delayed care, all of which have serious legal and ethical consequences. Additionally, proper specimen preservation and adherence to laboratory safety protocols protect both patients and co-workers from potential harm, including exposure to biohazards or chemical agents. Beyond patient considerations, your actions influence the workplace environment and your professional relationships. Maintaining a culture of safety, respect, and ethical conduct contributes to a positive and compliant laboratory setting. This includes following institutional policies, reporting any concerns about patient abuse or workplace violations, and documenting your work thoroughly and accurately. Such diligence not only protects patients but also safeguards your rights and those of your colleagues. The central theme we will explore throughout this course is the balance between rights and responsibilities. As histotechnologists, you have rights that protect your professional status, workplace safety, and fair treatment. At the same time, you hold responsibilities to patients, co-workers, employers, and the broader public. Understanding how to navigate and balance these sometimes competing demands is essential for maintaining professionalism, upholding ethical standards, and complying with legal requirements. In practical terms, this means being vigilant about specimen integrity, following all safety and confidentiality regulations, and knowing when and how to report concerns. You may face difficult decisions where patient welfare, workplace policies, and personal rights intersect. Having a clear understanding of your legal and ethical obligations will empower you to make informed decisions that uphold the highest standards of care and professionalism in histotechnology. In this course, we focus on two critical chapters from Posger's text that together provide a comprehensive view of professionalism within healthcare, particularly as it applies to laboratory settings like histotechnology. Chapter 13 centers on employee rights and workplace responsibilities, exploring the legal protections that healthcare workers are entitled to, as well as the duties they owe to their employers, colleagues, and patients. This includes understanding workplace safety, fair treatment, and the ethical obligations to maintain competence and integrity in all aspects of their work. Chapter 14 shifts attention to the sensitive and vital issues of child abuse, elder abuse, and the legal and ethical imperatives surrounding the reporting and prevention of such abuse. Healthcare professionals often serve as frontline protectors of vulnerable populations, and even in the laboratory, where direct patient contact may be limited, professionals can encounter signs or receive information that raises concerns about abuse. Recognizing these signs and knowing the mandatory reporting laws is essential to fulfilling one's ethical and legal responsibilities. Both chapters converge on a fundamental question: what should a healthcare professional do when something is wrong? This question is especially relevant in the laboratory environment, where histotechnologists and other lab staff may not witness abuse firsthand, but still play a crucial role in identifying irregularities or patterns that could indicate mistreatment. Ethical participation means being vigilant, understanding the legal framework for reporting, and acting promptly to protect patients. By integrating the perspectives of employee rights and responsibilities with the duty to recognize and respond to abuse, we develop a professional lens that guides ethical decision-making and legal compliance. This dual focus prepares you to navigate complex dilemmas that arise in the healthcare setting, ensuring that you uphold both your rights as an employee and your responsibilities as a protector of patient welfare. Understanding this balance is key to maintaining professionalism and fostering a safe, ethical workplace in histotechnology and beyond. Posger highlights a foundational concept in healthcare ethics and law: rights are never granted in isolation, they always come paired with corresponding duties. This principle is crucial for histotechnologists to understand because it frames how we approach our professional responsibilities. As employees, you have rights such as fair treatment, a safe working environment, and freedom from discrimination. However, these rights are balanced by your duties to uphold the ethical standards and technical competencies required in your role. Your responsibilities include maintaining accuracy in specimen processing, ensuring proper documentation, and safeguarding patient information. Patients, on the other hand, hold rights that must be respected and protected by all healthcare professionals, including those working behind the scenes in the laboratory. These rights include the right to dignity, safety, privacy, and protection from abuse or neglect. When you handle tissue specimens or manage patient data, you are directly influencing these rights. For example, a breach in confidentiality by improperly sharing patient information or careless labeling of specimens can compromise patient privacy and potentially affect diagnostic outcomes. Such errors not only violate patient rights but can also have serious legal and ethical repercussions. To navigate these responsibilities effectively, professionals must embody key virtues: competence, honesty, compassion, and courage. Competence means ensuring your technical skills meet established standards and that you remain current with evolving laboratory practices. Honesty is critical in maintaining accurate records and communicating truthfully about findings or errors. Compassion reminds us that behind every specimen is a human being whose care depends on our diligence. Courage is essential when facing ethical dilemmas or witnessing misconduct. It takes moral strength to speak up, even when doing so may be uncomfortable or risky. Understanding this balance between rights and duties helps you appreciate that your role extends beyond routine tasks. You are integral to fostering a culture of ethical practice and patient safety. This mindset builds trust within the healthcare team and reassures patients that their care is handled with integrity and respect. Recognizing that rights always come with duties empowers you to be both a skilled technician and a conscientious advocate for patient welfare. Employment at will is a foundational principle in American labor law, meaning that either the employer or the employee can terminate the employment relationship at any time and for almost any reason, or even for no reason at all. However, this doctrine is not without important limitations, especially in healthcare settings where patient safety and ethical obligations are paramount. Courts and legislatures have recognized that employment at will cannot be used as a shield for wrongful termination that violates public policy or legal protections. In healthcare, including histotechnology and laboratory environments, employees have specific duties to protect patients and uphold ethical standards. For example, if you report suspected patient abuse, refuse to engage in illegal or unethical practices, or raise concerns about unsafe laboratory procedures, you are legally protected from retaliation or wrongful termination. This protection stems from the recognition that public welfare and patient safety take precedence over an employer's unrestricted right to terminate employment. For histotechnologists, this means that while your employment may technically be at will, your actions taken in good faith to comply with laws, regulations, and professional ethical standards are safeguarded. If you observe breaches of patient confidentiality, unsafe specimen handling, or violations of laboratory safety protocols, you have not only the right but the responsibility to speak up. Doing so helps prevent harm to patients and maintains the integrity of the laboratory environment. Understanding these legal boundaries empowers you to act confidently when faced with ethical dilemmas or workplace challenges. It also underscores the importance of thorough documentation and clear communication when reporting concerns. Employers cannot lawfully dismiss or discipline you for fulfilling your professional duties to protect patients and uphold ethical standards. In summary, employment at will does not mean unlimited employer power. It is constrained by laws and policies designed to protect employees who act in the public interest, especially in healthcare settings where patient safety is critical. Public policy represents the foundational principles and standards established through statutes, regulations, and court decisions that serve the broader public interest. In the workplace, especially within healthcare settings, these policies are crucial because they protect employees who refuse to engage in illegal activities or who report violations that could harm patients, co-workers, or the public. For histotechnologists, understanding these protections is essential because your role often involves handling sensitive specimens, maintaining accurate documentation, and ensuring laboratory safety, all of which have direct implications for patient care and public health. When you encounter situations such as patient abuse, safety violations, or discrimination, public policy protections allow you to speak up without fear of retaliation. This legal safeguard encourages transparency and accountability, which are vital for maintaining ethical standards and patient safety in the laboratory environment. For example, if you notice unsafe laboratory practices that could compromise specimen integrity or patient diagnoses, reporting these concerns is not only ethical but also legally protected under whistleblower laws. Whistleblowing is a key mechanism through which public policy protects employees. It involves reporting wrongdoing, whether it's unsafe procedures, falsified data, or suspected abuse, to appropriate authorities. Courts have recognized that terminating or punishing an employee for such reports undermines the public good, especially when those reports aim to protect vulnerable patients or ensure workplace safety. This means that if you raise concerns about quality control issues or discriminatory behavior in your lab, the law may shield you from adverse employment actions. The central question courts consider in these cases is whether an employer's action, such as dismissal, retaliates against an employee for upholding public policy. If the termination conflicts with established policies designed to protect patients and employees, it may be deemed unlawful. For histotechnologists, this legal framework reinforces the ethical imperative to act courageously and responsibly. It empowers you to maintain safety and integrity in your professional role, knowing that the law supports your efforts to protect patients and uphold the standards of laboratory practice. Fair treatment in the workplace involves much more than simply being polite or friendly to one another. While kindness and respect are important, fairness is a broader concept that includes ensuring employees are evaluated accurately, workplace policies are applied consistently, and that everyone has access to due process when concerns or disputes arise. This means that decisions impacting an employee's job status, such as promotions, disciplinary actions, or terminations, must be based on reliable, factual information and follow established procedures that allow the employee to respond, clarify, or appeal those decisions. Without these safeguards, fairness cannot truly be achieved. Inaccurate or incomplete data can have serious consequences for employees. For example, if a histotechnologist's performance record contains errors or unverified criticisms, it can unjustly harm their professional reputation and limit future career opportunities. Such mistakes can also damage trust within the laboratory team, leading to a toxic work environment where employees feel undervalued, demoralized, or unfairly targeted. Supervisors and managers have a critical responsibility to listen carefully when employees raise concerns about potential errors or inconsistencies in their evaluations or workplace records. Ignoring these concerns not only undermines morale but can also expose the organization to legal risks, including claims of wrongful termination or discrimination. In the context of histotechnology and laboratory operations, fair treatment is closely linked to quality assurance and patient safety. For instance, if competency assessments or quality control data are mishandled or inaccurate, this can result in unqualified personnel performing critical tasks, which increases the risk of diagnostic errors that directly affect patient care. Moreover, flawed documentation or inconsistent application of policies can jeopardize laboratory accreditation, which depends on rigorous adherence to standards and protocols. Therefore, fairness is not only about protecting employee rights but also about maintaining the integrity and reliability of laboratory work, which ultimately safeguards patients. Understanding these principles equips you to advocate effectively for yourself and your colleagues while contributing to a professional, trustworthy laboratory environment. Fair treatment forms the foundation of an ethical workplace culture and supports the high standards necessary for quality patient care and safety in histotechnology. Discrimination in the workplace is not only a serious ethical violation, but also a breach of federal law, carrying significant legal consequences for both individuals and organizations. It is essential that employees are evaluated and treated solely based on their qualifications, skills, and job performance, without any bias or prejudice related to personal characteristics. Federal laws such as Title VII of the Civil Rights Act, the Americans with Disabilities Act, and the Age Discrimination in Employment Act protect employees from discrimination on the basis of race, color, religion, sex, pregnancy, national origin, age, disability, and genetic information. These protections ensure that critical employment decisions, such as hiring, promotions, work assignments, and disciplinary actions, are conducted fairly and equitably. In addition to prohibiting discrimination, the law also forbids retaliation against employees who raise concerns or file complaints about discriminatory practices. This means that if an employee reports discrimination or participates in an investigation, they must be shielded from adverse actions such as demotion, termination, or harassment. This protection is vital because it fosters a workplace culture where employees feel safe to speak up about wrongdoing without fear of reprisal, which ultimately supports a healthier, more transparent work environment. The Equal Employment Opportunity Commission, or EEOC, is the federal agency charged with enforcing these anti-discrimination laws. The EEOC investigates complaints, facilitates mediation between parties, and has the authority to bring lawsuits against employers who violate these laws. For laboratory professionals, including histotechnologists, understanding these legal protections is crucial. Discrimination can affect everything from the recruitment and retention of qualified staff to the overall morale and inclusiveness of the workplace. In the histotechnology laboratory, where precision, teamwork, and clear communication are essential for producing accurate and reliable test results, discrimination can have far-reaching consequences. It can undermine collaboration, reduce trust among coworkers, and ultimately compromise the quality of laboratory work. By ensuring that all employees are judged fairly and treated with respect, we maintain a positive workplace culture that supports both employee well-being and patient safety. Being knowledgeable about these legal frameworks empowers you to recognize discrimination and advocate for equitable treatment, which is a fundamental part of your professional responsibility in the laboratory setting. Ensuring equal pay for equal work is not only a legal mandate, but also a fundamental ethical principle in the workplace. The Equal Pay Act, a key piece of federal legislation, specifically prohibits wage discrimination based on sex. It requires that men and women performing jobs that demand substantially equal skill, effort, and responsibility, and that are carried out under similar working conditions, must receive equal compensation. This law plays a critical role in addressing the persistent wage gap and fostering fairness in how employees are remunerated. However, it is important to understand that equal pay does not mean every employee must receive the exact same salary. Legitimate differences in pay can exist when they are based on objective, non-discriminatory factors such as seniority, merit, productivity, or the quality and quantity of work performed. For example, in a histotechnology laboratory, a technologist with more years of experience or who consistently produces higher quality slides or processes a greater volume of specimens might justifiably earn a higher wage than a colleague who is newer or less productive. The key is that these differences must be grounded in clear, documented criteria that are applied consistently and fairly, not on arbitrary or discriminatory reasons. Transparency and thorough documentation are essential tools for preventing wage discrimination and promoting trust in the workplace. Employers who openly communicate their compensation policies and maintain detailed records of how pay decisions are made can better defend against claims of unequal treatment. For histotechnologists, understanding these principles is especially important because pay disparities can directly affect morale, job satisfaction, and employee retention, all of which impact the quality and reliability of laboratory services. By advocating for fair and transparent pay practices, you help create a workplace culture that values equity and respects the contributions of every team member. This commitment not only benefits individual employees but also enhances the overall professionalism and effectiveness of the laboratory, ultimately supporting better patient care through consistent and motivated staff performance. Healthcare professionals sometimes encounter situations where their personal moral or religious beliefs conflict with certain medical procedures or treatments. These conscience rights allow individuals to object to participating in specific practices, such as elective abortions, blood transfusions, or certain end-of-life care decisions. Respecting these rights is essential for honoring individual beliefs, promoting diversity within the healthcare workforce, and supporting employee well-being. However, it is equally important to recognize that these rights are not unlimited. In healthcare settings, conscience rights must be balanced against the fundamental obligation to provide safe, timely, and legally mandated patient care. Healthcare organizations have a duty to ensure that patients receive all necessary treatments without undue delay or denial, regardless of individual staff objections. This means that if a healthcare worker refuses to participate in a procedure due to conscience objections, the organization must have clear policies and systems in place to ensure another qualified professional can step in promptly. This safeguard protects patients from harm and maintains continuity of care. In the laboratory environment, this balance can present unique challenges. For example, a histotechnologist might object on moral grounds to handling specimens related to certain procedures or performing tests that conflict with their beliefs. While their conscience rights deserve respect, the laboratory still has a responsibility to fulfill its role in patient diagnosis and treatment. Refusal to perform assigned duties cannot compromise patient care or laboratory operations. Therefore, laboratories should establish clear guidelines on how to address such objections, including reassignment options or alternative workflows, to ensure that patient care remains uninterrupted. Understanding the interplay between conscience rights and patient safety helps laboratory professionals navigate complex ethical situations with professionalism and integrity. It also underscores the importance of transparent communication and well-defined institutional policies that support both employee rights and patient welfare. Ultimately, the goal is to foster an environment where healthcare workers' conscience rights are acknowledged but never exercised in a way that jeopardizes patient well-being or violates legal and ethical standards. This approach upholds the trust placed in healthcare professionals and reinforces the commitment to patient-centered care. Pharmacists sometimes face difficult ethical dilemmas when their personal beliefs conflict with their professional responsibilities. This tension became especially pronounced after the Dobbs decision, which significantly changed abortion laws across many states and created a complex legal environment regarding access to certain medications. Some pharmacists have chosen to refuse dispensing drugs that they believe could be used to induce abortions, even when those same medications have legitimate and important uses for other medical conditions. This situation highlights the competing rights that exist within healthcare: the right of healthcare providers to act according to their conscience, and the right of patients to access legally prescribed medications essential to their health and well-being. From a legal and ethical standpoint, pharmacists have the right to conscientious objection, which is often grounded in moral or religious beliefs. However, this right is not absolute and must be balanced against the patient's right to timely and appropriate care. When laws are unclear or inconsistently applied, pharmacists may hesitate to dispense certain medications out of fear of legal consequences, leading to what is sometimes called a chilling effect. This hesitation can delay or deny patient access to necessary treatments, potentially causing harm. The challenge lies in finding policies that respect the conscience rights of providers while ensuring that patients do not suffer from lack of access or unnecessary barriers to care. While histotechnologists may not directly dispense medications, the principle of balancing provider conscience with patient access remains relevant. Laboratory professionals may encounter specimens or testing requests related to controversial treatments, such as genetic testing or hormone therapies, where personal beliefs might conflict with professional duties. Understanding these competing rights helps you appreciate the complex ethical landscape in healthcare and prepares you to navigate similar dilemmas thoughtfully. Clear institutional policies, open communication, and a commitment to patient-centered care are essential to minimize confusion and ensure that both provider rights and patient needs are respected. Being informed about these issues strengthens your ability to respond professionally and ethically when faced with challenging situations in the laboratory setting. In healthcare settings, including the laboratory environment, questioning orders or care plans that seem unsafe or potentially harmful is not only acceptable, it is often an ethical and legal obligation. As histotechnologists and laboratory professionals, you play a critical role in patient safety, even though you may not provide direct bedside care. When you encounter instructions or procedures that appear inconsistent with clinical information or that violate safety protocols, you have a responsibility to verify these concerns. This means taking the time to confirm that the order or procedure is accurate and appropriate before proceeding. If after verification doubts remain, the next essential step is escalation. This involves communicating your concerns to a higher-level clinician, supervisor, or another appropriate authority within your institution. Escalation is a vital safeguard that helps prevent errors and protects patients from harm. It also demonstrates your commitment to professional standards and patient advocacy. For instance, if you notice a biopsy specimen label that does not match the patient's identifying information, raising this issue immediately can prevent diagnostic errors that might lead to incorrect treatment decisions. Documentation is the final and equally important step in this process. Recording your concerns and the actions you took creates a clear, traceable record that can be crucial if an adverse event occurs or if legal questions arise later. Proper documentation protects both the patient and you as a professional, showing that you acted responsibly and in good faith. Failing to speak up or remain silent when you suspect harm can lead to serious ethical violations and legal liability, including charges of negligence or malpractice. By embracing this duty to question and report, you contribute to a culture of safety and accountability within the laboratory and the broader healthcare team. Your vigilance not only protects patients but also supports your colleagues and upholds the integrity of laboratory practice. Remember, your proactive attention to detail and willingness to raise concerns can make a critical difference in patient outcomes and help maintain the highest professional standards in histotechnology. In this case study, we explore the experience of a nurse who courageously raised concerns about a delayed treatment for a patient suspected of having toxic shock syndrome, a life-threatening condition that requires prompt intervention. This case powerfully illustrates the vital role healthcare workers play as advocates for their patients, emphasizing that speaking up is not only an ethical responsibility but also a legal one. The court's decision to recognize the nurse's public policy duty to report the delay affirms that healthcare professionals are protected when they act in the patient's best interest, even if their actions challenge decisions made by others or disrupt the usual chain of command. For histotechnologists, this case offers important lessons about advocacy within the laboratory setting. Although we often work behind the scenes, our role in ensuring accurate, timely, and reliable diagnostic results is a critical form of patient advocacy. When you identify discrepancies in specimen labeling, delays in processing, or potential errors in reporting, it is essential to raise these concerns promptly. Failure to do so can compromise patient safety and treatment outcomes. However, this case also highlights the potential risks involved, including retaliation from colleagues or supervisors, which may manifest as subtle exclusion from workplace activities or more overt disciplinary measures. Understanding the distinction between advocacy and insubordination is crucial. Advocacy is grounded in professional ethics and a commitment to patient safety, while insubordination implies defiance without justification. When raising concerns, it is important to communicate clearly, respectfully, and factually, focusing on the patient's well-being rather than personal grievances. This approach aligns with legal protections demonstrated in this case, where the nurse's actions were upheld because they served a legitimate public policy interest. Ultimately, this case encourages all healthcare workers, including histotechnologists, to recognize their duty to advocate for patients and to understand the legal frameworks that protect them when they do so appropriately. Speaking up is not just an ethical imperative, it is a legally supported responsibility that helps safeguard patient care and uphold professional integrity within the healthcare system. In healthcare settings, there are times when a patient's condition or needs may be better addressed by a different physician or specialist. As histotechnologists, although we work primarily behind the scenes, we have a professional responsibility to advocate for patient safety and quality care. This can sometimes involve suggesting that a patient be evaluated by another clinician who may have more expertise or a different approach better suited to the patient's situation. When done appropriately, such suggestions are not only ethically sound, but can also be legally protected. The key to ensuring protection lies in how these recommendations are communicated. It is essential to remain factual, objective, and focus solely on the patient's best interests. This means avoiding personal judgments or criticisms about a colleague's competence or behavior. For example, if repeated issues arise, such as consistent errors in specimen labeling or unclear communication from a particular provider, raising these concerns should be framed in terms of improving diagnostic accuracy and patient safety. The emphasis must always be on the impact to the patient's care, not on disparaging the provider. From a legal standpoint, this careful approach helps reduce the risk of defamation claims or workplace conflicts. It also supports a collaborative healthcare environment where all team members work together toward the patient's well-being. In histotechnology, this might involve alerting a clinician when unusual histologic findings suggest the need for additional testing or a second opinion, thereby facilitating timely and appropriate patient management. Moreover, documentation plays a critical role in protecting both the patient and the staff member making the suggestion. Clear, objective records of concerns and communications help demonstrate that the recommendation was made professionally and with the patient's safety as the priority. When histotechnologists act with professionalism, respect, and a clear patient-centered focus, their actions are more likely to be supported by employers and protected under public policy. Ultimately, advocating for the right clinician at the right time is an important part of our ethical duty to ensure patients receive the highest standard of care. Disruptive conduct in healthcare environments can take many forms, such as intimidation, bullying, threats, and humiliating behavior. These actions are not just interpersonal problems, they have serious consequences for patient care and safety. When staff members feel threatened or belittled, communication breaks down, collaboration suffers, and errors become more likely. In a histology laboratory where precise specimen handling, accurate documentation, and clear communication are essential, any disruption can lead to mistakes that affect diagnoses and treatment decisions. Every healthcare worker, including histotechnologists, has the right to work in a respectful and safe environment free from disruptive behavior. This right is fundamental because the laboratory depends on teamwork and open dialogue to maintain quality and safety. For example, if a histotechnologist feels intimidated by a supervisor or coworker, they may hesitate to ask important questions about specimen labeling, processing protocols, or unusual findings. This reluctance can increase the risk of specimen misidentification, processing errors, or delayed reporting, all of which compromise patient outcomes. Creating a professional culture that encourages speaking up without fear of retaliation is critical. Organizations must implement clear policies that define unacceptable behaviors and outline procedures for reporting and addressing disruptive conduct. Histology labs should foster an environment where all team members feel psychologically safe to raise concerns, report errors, or suggest improvements. Such a culture not only protects the mental health and job satisfaction of staff, but also upholds the integrity of laboratory operations and patient care. In summary, recognizing and addressing disruptive behavior is a shared responsibility among all healthcare professionals. By promoting respect, professionalism, and open communication, healthcare teams can reduce errors, enhance collaboration, and ultimately improve patient safety and outcomes. For histotechnologists, this means understanding that their role extends beyond technical tasks to include contributing to a positive workplace culture that supports high-quality laboratory practice. Sexual harassment is a critical issue in healthcare workplaces, including histotechnology laboratories, and it constitutes serious misconduct that cannot be tolerated. It takes two primary forms: Quid pro quo harassment, where employment decisions such as promotions, raises, or continued employment are contingent upon submission to sexual advances or favors. And hostile work environment harassment, which involves unwelcome verbal or physical conduct that creates an intimidating, hostile, or offensive atmosphere. Both forms undermine the professional environment and violate federal laws such as Title VII of the Civil Rights Act of 1964, which prohibits workplace discrimination and harassment based on sex. Healthcare settings are not exempt from these laws. In fact, because of the sensitive nature of healthcare work, where trust, teamwork, and clear communication are essential for patient safety and quality outcomes, sexual harassment poses an even greater risk. For histotechnologists who often work closely with colleagues, supervisors, and other healthcare professionals, maintaining a respectful workplace is vital. Harassment can disrupt workflow, damage morale, and compromise the integrity of laboratory operations. Supervisors and healthcare organizations have both legal and ethical responsibilities to address any allegations of sexual harassment promptly and thoroughly. Ignoring or minimizing complaints can lead to legal liability for the institution, including costly lawsuits and damage to its reputation. More importantly, failing to act can perpetuate harm to victims and create a culture where harassment is tolerated. Histotechnologists should be aware of their right to report harassment through established channels, such as human resources departments, compliance officers, or anonymous hotlines, and understand that retaliation against those who report is illegal. An ethical workplace culture is built on mutual respect among all employees, regardless of their role or status. This respect is just as important as the respect owed to patients. Laboratories must implement clear policies that define unacceptable behavior, provide regular training on harassment prevention, and ensure support systems are in place for victims. Documentation of incidents and responses is essential to demonstrate compliance and to protect both employees and the organization. In summary, recognizing sexual harassment as serious workplace misconduct reinforces the need for professionalism and respect in every interaction. Histotechnologists share a collective responsibility to foster a safe, respectful environment that upholds ethical standards and protects everyone's dignity and well-being. Every employee is entitled to a workplace that is reasonably free from recognized hazards, a principle that is especially critical in healthcare settings. In histotechnology laboratories, the range of potential dangers is broad and complex. Workers routinely handle chemicals such as formalin and xylene, which are known to be toxic and require careful handling to prevent harmful exposures. Additionally, histotechnologists deal with sharps like needles and blades, which carry the risk of injury and potential transmission of infectious agents. The specimens themselves may contain biohazards, including blood-borne pathogens, making strict adherence to infection control protocols essential. Beyond chemical and biological risks, ergonomic hazards from repetitive motions or improper workstation setup can lead to musculoskeletal injuries over time. Creating a safe work environment extends beyond simply having safety policies documented or posted on walls. It requires integrating those policies into daily practice and fostering a culture where safety is a shared responsibility. For example, proper use of personal protective equipment, gloves, lab coats, eye protection, and sometimes respirators, is not optional but mandatory to minimize exposure risks. Correct handling and disposal of sharps must be routine to prevent accidental injuries, and chemical safety protocols, including proper ventilation and spill response, must be rigorously followed. These behaviors protect not only the individual employee but also co-workers and, ultimately, the patients whose specimens are processed. The Occupational Safety and Health Administration, or OSHA, provides a comprehensive framework for maintaining workplace safety. This includes identifying hazards through regular risk assessments, implementing controls to reduce those risks, providing ongoing employee training, and maintaining thorough documentation of incidents and corrective actions. Compliance with OSHA standards is not only a legal obligation, but also a critical component of ethical laboratory practice. Histology labs must actively engage in these processes to ensure a safe environment and to avoid penalties that can arise from non-compliance. Ultimately, a safe work environment benefits everyone involved. It reduces the incidence of injuries and illnesses, which in turn improves employee morale and productivity. When staff feel safe and supported, they are more likely to perform their duties accurately and efficiently, contributing to high-quality laboratory operations. Histotechnologists play a vital role in this dynamic by consistently following safety protocols and advocating for improvements when hazards are identified. By doing so, they uphold their professional responsibilities and help create a workplace where everyone can thrive. Professionalism forms the cornerstone of every employee's responsibilities in healthcare, and this is especially true in histotechnology. While technical proficiency in specimen processing, staining techniques, and microscopic analysis is essential, professionalism extends far beyond these skills. It encompasses adherence to job descriptions, institutional policies, legal requirements, and established professional standards. For histotechnologists, this means consistently demonstrating reliability, integrity, and ethical behavior in all aspects of their work. Being professional involves more than just performing tasks correctly. It requires a commitment to accuracy, accountability, and ethical decision-making. For example, ensuring that specimen labels are accurate and match the patient's information is critical not only for diagnostic accuracy, but also for patient safety and legal compliance. Mistakes in labeling or documentation can lead to misdiagnosis, inappropriate treatment, and potential harm to patients, as well as legal liability for the laboratory and institution. Professionalism also extends to maintaining patient confidentiality. Histotechnologists often handle sensitive patient information, and protecting this data is both an ethical obligation and a legal requirement under laws such as HIPAA. This means safeguarding electronic records, limiting access to authorized personnel, and being vigilant against inadvertent disclosures. Teamwork is another vital aspect of professionalism. Histotechnologists work closely with pathologists, laboratory technicians, and clinical staff. Effective communication and collaboration ensure that specimens are processed efficiently and that any issues are promptly addressed. Being a dependable team member fosters trust and supports a culture of safety and quality within the laboratory. Furthermore, practicing safely is a fundamental professional responsibility. This includes following protocols for handling biohazardous materials, using personal protective equipment correctly, and adhering to safety guidelines to prevent workplace injuries and contamination. A professional histotechnologist understands that their actions directly impact not only patient outcomes but also the health and safety of colleagues. In summary, professionalism in histotechnology is characterized by consistent, disciplined behavior that upholds quality, ethical standards, and accountability. It protects patients, supports colleagues, and maintains the integrity of the healthcare system. By embracing these responsibilities, histotechnologists contribute meaningfully to patient care and the broader mission of healthcare. When we think about compassion in healthcare, it's natural to picture doctors, nurses, or other caregivers who interact directly with patients at the bedside. However, compassion is just as vital in the laboratory, where histotechnologists contribute significantly to patient care behind the scenes. Every tissue specimen you handle represents a real person's health story. The slides you prepare, the tissue blocks you cut, the stains you apply, and the reports you help generate all influence critical diagnostic decisions and treatment plans. Understanding this connection fosters a deeper sense of responsibility and empathy for the individuals behind each specimen. Compassion in the lab is not simply about kindness, it is about approaching your work with conscientiousness and respect for patient dignity. A judgmental or indifferent attitude can undermine both the quality of your work and the empathy that should guide it. When you perform your tasks with compassion, you strive for accuracy and precision because you recognize that errors or shortcuts could lead to misdiagnosis or inappropriate treatments, potentially causing harm. This mindset encourages meticulous attention to detail and a commitment to excellence, which are essential in maintaining patient safety. Practically speaking, professional compassion means acknowledging the human element in every specimen you process. It motivates you to adhere strictly to protocols, to double-check your work, and to communicate clearly and effectively with your colleagues. This approach helps maintain high standards and supports a culture of care within the fast-paced, technical environment of the histology laboratory. Moreover, compassion aligns with ethical duties to protect patient confidentiality and to report any concerns about specimen integrity or patient safety promptly. As future histotechnologists, embracing compassion as a core part of your professional identity will not only improve patient outcomes but also enhance your job satisfaction and professional integrity. Recognizing that your work impacts real lives reinforces the importance of ethical practice, attention to detail, and respectful communication. In this way, compassion truly belongs in the laboratory, shaping how you approach every task and decision you make. Compliance with healthcare regulations is an absolute requirement for every healthcare organization, and laboratories are no exception. These regulations come from multiple levels: federal, state, and local authorities, and together they establish the legal framework that governs laboratory operations. As histotechnologists, your daily work directly impacts whether your laboratory meets these regulatory standards. Every step you take, from proper specimen handling and processing to meticulous documentation, contributes to your organization's compliance or non-compliance status. Failure to comply with these regulations can have serious consequences. Regulatory agencies may impose civil penalties such as fines, require corrective actions, or even revoke laboratory accreditation. In more severe cases, criminal charges could be brought if negligence or intentional misconduct is involved. For example, mishandling specimens or incomplete record-keeping can trigger investigations that jeopardize the lab's reputation and operational status. This highlights why compliance is non-negotiable. It is a fundamental professional obligation that protects patients, staff, and the institution. In the laboratory setting, compliance covers several critical areas. Accurate and thorough documentation is essential. It must reflect every step of specimen processing and testing to ensure traceability and accountability. Safety protocols are equally important to protect laboratory personnel from hazards such as chemical exposures or biohazards, and to prevent cross-contamination that could compromise patient results. Quality control procedures must be rigorously followed to guarantee the reliability and reproducibility of test outcomes. Additionally, laboratories often seek accreditation from organizations like the College of American Pathologists, CAP, or the Joint Commission, which enforce stringent standards that go beyond basic regulatory requirements. Understanding and adhering to these standards is part of your professional responsibility as a histotechnologist, safeguarding the integrity of diagnostic processes and ultimately supporting patient care. Remember, compliance is not just about avoiding penalties. It is about maintaining trust in the healthcare system and ensuring that patients receive accurate, timely, and safe diagnostic services. Your role as a histotechnologist is integral to this mission, and embracing compliance as a non-negotiable aspect of your work ethic is essential for your professional success and the well-being of those you serve. Organizational policies and procedures are foundational to maintaining a safe, effective, and legally compliant laboratory environment. They are not arbitrary rules imposed without reason. Rather, they serve as a bridge between complex laws, professional standards, and practical safety principles. These policies translate broad legal mandates and ethical guidelines into specific, actionable expectations that guide your daily work as a histotechnologist. Following these policies consistently is not optional. It is an essential professional responsibility that protects patients, staff, and the institution as a whole. Consider the example of the operating room journey, where visible hazards posed risks to both patients and healthcare workers. This case underscores the critical role policies play in identifying potential dangers before they result in harm. In a histology laboratory, similar policies govern specimen labeling, handling and disposal of hazardous chemicals, and reporting of errors or near misses. These protocols are designed to prevent mistakes such as mislabeling specimens, which can lead to misdiagnosis, or improper chemical handling, which could cause injury or contamination. By adhering to these policies, you help ensure the accuracy of diagnostic results and the safety of everyone in the laboratory. Ignoring or circumventing policies can have serious consequences. From a legal standpoint, non-compliance can expose the organization to lawsuits, regulatory penalties, and damage to its reputation. For you as a histotechnologist, failure to follow policies may result in disciplinary action, including suspension or loss of certification, which can impact your career. Moreover, non-compliance can compromise patient safety, which is the core ethical obligation of all healthcare professionals. Understanding the rationale behind each policy fosters a deeper appreciation for its importance and encourages full compliance. Policies exist to protect patients from harm, safeguard employees from workplace hazards, and shield the institution from legal and ethical violations. Your role in following these policies is vital to maintaining a laboratory environment that is not only efficient and accurate but also safe and ethically sound. Recognizing that these guidelines are carefully crafted to uphold public trust and professional integrity will help you embrace your responsibilities with confidence and professionalism. Your job description in the histology laboratory is far more than a simple checklist of tasks. It is a formal statement of your professional responsibilities and the standards to which you will be held accountable. Each duty assigned to you is directly connected to patient safety, which is the cornerstone of ethical and legal practice in healthcare. When you perform your assigned tasks accurately and thoroughly, you contribute to the reliability of diagnostic results and ensure that critical information reaches clinicians in a timely manner. This, in turn, supports appropriate patient care decisions. On the other hand, neglecting or improperly executing your duties can introduce errors that may lead to misdiagnosis, delayed treatment, or even harm to patients. Such failures not only jeopardize patient well-being but also expose you to disciplinary actions, including possible termination or legal consequences. In the histology lab, even seemingly minor errors can have significant downstream effects. For example, if a tissue block is improperly processed or a slide is mislabeled, the pathologist may interpret the specimen incorrectly, potentially resulting in a wrong diagnosis. This could delay necessary treatment or lead to inappropriate therapy, both of which can have serious health implications for the patient. This reality underscores why competency in your assigned duties is not just a professional expectation but a legal obligation. You are required by law and professional standards to perform your work competently, which means adhering to established protocols, maintaining accuracy, and continuously updating your skills. Competency also involves ongoing education and professional development. Laboratory technologies and procedures evolve rapidly, and staying current with these changes ensures that you can fulfill your responsibilities effectively and safely. Accepting your assigned duties means accepting the responsibility to protect patient safety through careful, knowledgeable, and conscientious work. This mindset highlights the critical role histotechnologists play within the healthcare team and reinforces the importance of accountability in your professional practice. Ultimately, your commitment to performing your duties with competence and integrity safeguards not only patients but also the reputation and quality standards of your laboratory and institution. Patients possess fundamental rights that must be respected and upheld throughout every stage of their healthcare experience. These rights include the preservation of their dignity, the recognition of their autonomy, and their active participation in decisions regarding their care. It is important to understand that these rights extend beyond direct interactions between patients and clinicians. They apply to every healthcare professional involved in the patient's care continuum, including those working behind the scenes in the laboratory. As histotechnologists, although you may not routinely engage directly with patients, honoring patient rights remains an essential part of your professional and ethical responsibilities. One critical aspect of patient autonomy is the use of advanced directives and the expression of personal healthcare preferences. While histotechnologists typically do not handle these documents, the accuracy and reliability of laboratory results you generate are foundational to supporting patients' informed decision-making. For example, the precise preparation and analysis of tissue slides directly influence the accuracy of diagnoses. These diagnoses form the basis for physicians and patients to discuss treatment options confidently and make choices aligned with the patient's values and wishes. Respect for patient rights within the laboratory setting also involves maintaining strict confidentiality of patient information. Protecting patient privacy means ensuring that all specimen labels, reports, and electronic data are handled securely and only accessed by authorized personnel. Additionally, treating specimens with care and attention to detail not only supports diagnostic accuracy, but also honors the dignity of the individual from whom the specimen was obtained. Errors or lapses in specimen handling can lead to misdiagnosis, delayed treatment, or harm, which ultimately undermines patient trust in the healthcare system. By consistently upholding these principles, confidentiality, accuracy, and respect, you contribute to a healthcare environment where patients feel valued and empowered. Recognizing and honoring patient rights reinforces the ethical foundation of your work and helps build trust between patients and the broader healthcare team. In this way, your role as a histotechnologist is integral not only to scientific analysis but also to the ethical delivery of patient care. Confidentiality is fundamental to healthcare ethics and legal standards, and it extends to every individual involved in patient care, including histotechnologists. Regardless of whether patient information is shared verbally, stored in electronic health records, or documented on paper, it must be protected with the utmost care. This responsibility is not limited to physicians or nurses. It encompasses all personnel who have access to patient data, such as students, volunteers, consultants, contractors, and laboratory staff. Each person shares the duty to safeguard this sensitive information from unauthorized disclosure. For histotechnologists, confidentiality takes on particular significance because you often encounter diagnostic information before it reaches the treating physician or the patient. For example, you may review biopsy results, genetic testing data, or other pathology reports that contain highly sensitive and personal health details. Maintaining discretion in handling this information is essential not only to comply with legal requirements like HIPAA, but also to uphold the trust patients place in the healthcare system. Breaches of confidentiality can lead to serious consequences, including legal penalties, disciplinary action by professional boards, and damage to your professional reputation. Beyond legal risks, violating confidentiality undermines patient trust and can harm the therapeutic relationship. It is critical to avoid discussing patient cases outside of professional settings, refrain from sharing information on social media or with unauthorized individuals, and adhere strictly to your organization's policies on data security and privacy. In the laboratory setting, this means protecting specimen labels, securing electronic systems with passwords, and ensuring that reports are only accessible to authorized personnel. Documentation should be accurate and stored securely, and any communication about patient information should be conducted discreetly. By consistently upholding confidentiality, histotechnologists contribute to a respectful, trustworthy healthcare environment that benefits patients and supports the integrity of the laboratory profession as a whole. This commitment aligns with broader ethical principles of respect for persons and professional responsibility, reinforcing the vital role that every healthcare worker plays in protecting patient rights. When we discuss compliance reporting in the laboratory setting, it's essential to appreciate the careful balance that compliance officers and laboratory personnel must maintain. These individuals are responsible for protecting sensitive information and maintaining confidentiality, while simultaneously fulfilling their legal and ethical obligations to their employer, the patients, and the public at large. For histotechnologists, this balance is particularly important because your daily work involves handling patient specimens, data, and documentation that directly affect patient safety and institutional integrity. Understanding how compliance reporting works within your organization is critical. Many employees mistakenly believe that raising concerns informally or casually mentioning problems will suffice, or that their concerns might be ignored. However, most healthcare institutions have formalized reporting mechanisms designed to protect employees who come forward. These often include anonymous hotlines or secure electronic reporting systems that help safeguard your identity and reduce fears of retaliation. This is especially relevant in laboratory environments, where hierarchical structures or workplace dynamics might make it intimidating to report errors or unsafe practices directly to supervisors. When you do report compliance issues, whether it's a suspected safety violation, a breach of protocol, or unethical behavior, your documentation must be precise, factual, and professional. Avoid speculation, assumptions, or emotional language. Focus on verifiable details, dates, times, observed behaviors, and specific incidents. This approach not only strengthens the credibility of your report, but also ensures that any corrective actions taken are based on accurate and objective information. In histotechnology, where meticulous documentation is already a cornerstone of your work, applying the same rigor to compliance reporting supports a culture of safety, accountability, and continuous quality improvement. Ultimately, careful and responsible compliance reporting protects everyone involved: the patient, the laboratory team, and the institution. It fosters an environment where concerns can be addressed constructively, helping to prevent errors before they cause harm. By understanding your rights and responsibilities in this process, you contribute to a safer workplace and better patient outcomes. Safety in healthcare is often thought of as something visible: signs, protocols, and protective equipment, but many of the most serious harms are invisible until they result in patient injury or compromise diagnostic outcomes. In histotechnology, this invisible harm can take the form of contamination, mislabeling, or procedural errors that may not be immediately apparent but have profound consequences. Basic safety practices like rigorous hand hygiene, accurate patient and specimen identification, and strict infection control are not mere formalities or checkboxes. They are essential safeguards that prevent harm before it occurs. For instance, consider the impact of a contaminated tissue specimen. If cross-contamination occurs during processing, it can lead to inaccurate pathology results, misdiagnosis, or delayed treatment. Such errors can trigger a cascade of additional testing, unnecessary treatments, or worse, patient harm. From a legal and ethical standpoint, these outcomes are preventable and highlight the critical importance of maintaining a culture of safety. This culture depends on consistency, doing the right thing every time, even when no one is watching. In the laboratory, much of the work happens behind the scenes, away from direct patient contact, but the implications for patient care are significant and demand unwavering attention to detail. Safety is not a one-time effort but a continuous commitment. It requires vigilance, strict adherence to established protocols, and the courage to speak up if something seems amiss. Histotechnologists play a vital role in this process by ensuring that every step, from specimen receipt and handling to slide preparation and documentation, meets the highest standards. This includes maintaining sterile environments, preventing cross-contamination, and accurately documenting all procedures. Such diligence protects not only patients but also the integrity of the laboratory's work and the credibility of the healthcare system as a whole. In summary, while the harms we prevent may be invisible at first, the practices that protect against them must be visible, consistent, and deeply ingrained in laboratory culture. This commitment to safety preserves patient trust, supports accurate diagnoses, and upholds the ethical and legal responsibilities of every healthcare professional. Ethics in healthcare firmly supports the principle that mistakes must be disclosed and corrected promptly. This commitment is rooted in fundamental ethical values such as honesty, beneficence, which means actively doing good, non-maleficence, or avoiding harm, and respect for patient autonomy. When errors occur, failing to admit them or attempting to conceal them not only breaches these ethical principles but also deprives patients of their right to make informed decisions about their care. Transparency is essential because it empowers patients and supports trust in the healthcare system. In the histotechnology laboratory, errors can take many forms, including mislabeling specimens, processing errors, or inaccuracies in reporting results. Each of these mistakes carries the potential for serious consequences, such as incorrect diagnoses, inappropriate treatment plans, or delays in patient care. For example, a mislabeled biopsy specimen could lead to a patient receiving treatment for the wrong condition or missing critical therapy altogether. Because of this, laboratories must establish clear protocols for reporting and correcting errors as soon as they are identified. Prompt disclosure and correction serve multiple important functions. First, they help restore trust between patients and healthcare providers by demonstrating accountability and commitment to quality care. Second, they create opportunities for learning and improvement within the laboratory environment. When errors are openly discussed, the team can analyze root causes and implement changes to prevent similar mistakes in the future. This culture of transparency fosters continuous quality improvement and patient safety. Conversely, attempting to cover up mistakes fosters a culture of fear and mistrust. It discourages open communication and can lead to repeated errors, ultimately compromising patient safety and damaging professional integrity. For histotechnologists, embracing honesty means not only reporting errors when they occur but also actively participating in corrective actions and quality assurance processes. This ethical approach protects patients, supports colleagues, and enhances the laboratory's reputation for reliability and professionalism. In summary, acknowledging and correcting mistakes is not just a legal or procedural obligation, it is a core ethical responsibility that upholds the standards of care we owe to every patient. As healthcare professionals, histotechnologists have a fundamental duty to report any unsafe or unethical behavior they encounter in the laboratory setting. This responsibility goes beyond simply adhering to institutional policies. It is a critical component of protecting patient safety and preserving the integrity of our profession. When unethical conduct is ignored or goes unreported, it risks becoming normalized, which can erode the quality of care and compromise patient outcomes. In the context of histotechnology, unethical behavior might manifest as falsifying or manipulating test results, bypassing established safety protocols, or engaging in discriminatory practices against colleagues or patients. Each of these actions has the potential to cause significant harm, not only to patients but also to the laboratory team and the broader healthcare system. Reporting unethical behavior is essential to prevent harm and uphold professional standards. It is important to understand that following your institution's chain of command is the first step, but reporting should never cease if patient safety remains at risk. In some cases, this may require escalating concerns beyond immediate supervisors to higher management, compliance officers, or even external regulatory agencies such as state health departments or professional licensing boards. This escalation is particularly crucial when internal reporting mechanisms fail to address the issue adequately or when retaliation is feared. Remaining silent in the face of unethical conduct can be interpreted as complicity, allowing harmful behaviors to persist unchecked. This not only endangers patients but also undermines trust among co-workers and damages the reputation of the laboratory profession. Cultivating the courage to speak up and understanding the appropriate channels for reporting are vital skills for histotechnologists. These skills help create a culture of accountability and safety, where everyone is empowered to act in the best interest of patients and colleagues. Ultimately, reporting unethical behavior protects patients, supports your colleagues, and strengthens the profession as a whole. It fosters a safer, more trustworthy healthcare environment where histotechnologists and other healthcare workers can perform their roles with confidence, integrity, and a shared commitment to ethical practice. Remember, your voice is a powerful tool in maintaining the standards that safeguard patient care and professional excellence. Continuing education is fundamental to maintaining professionalism and competence in healthcare, especially in specialized fields like histotechnology. The legal and ethical landscape, along with scientific knowledge, is continually evolving. This means that what you learn during your initial training is only the foundation. To provide safe, effective, and ethically sound care, you must stay current with new developments. For histotechnologists, this involves regularly updating both your technical skills, such as staining techniques, tissue processing, and microscopy, and your understanding of the legal and ethical responsibilities that govern laboratory practice. Viewing continuing education as a lifelong legal and professional obligation is crucial. Regulatory bodies such as the American Society for Clinical Pathology (ASCP) and state licensing boards often mandate ongoing education to maintain certification and licensure. These requirements are not arbitrary. They exist because healthcare is dynamic, and patient safety depends on practitioners who are knowledgeable about the latest standards and regulations. Beyond simply meeting these mandates, continuing education empowers you to adapt to new technologies, methodologies, and ethical standards that directly impact your work in the laboratory. For example, advances in molecular diagnostics or digital pathology require new competencies, while changes in privacy laws like HIPAA affect how patient information must be handled. Competence is not a static achievement but a continuous process that demands commitment to growth and reflection. This includes understanding new healthcare laws that influence patient privacy, informed consent, and workplace safety. For instance, recent updates in mandatory reporting laws for elder abuse or workplace violence prevention may affect your responsibilities as a laboratory professional. By staying informed, you ensure that your practice aligns with current legal expectations and ethical norms. Maintaining your professional education also fosters a culture of excellence and accountability within your laboratory, promoting trust among patients, colleagues, and employers. In summary, ongoing education is far more than a box to check for certification. It is essential for ensuring that you provide the highest quality care and uphold the ethical standards expected of healthcare professionals throughout your career. By committing to lifelong learning, you protect not only your patients but also your professional integrity and the reputation of the histotechnology field. As we wrap up the key concepts from Chapter 13, it's essential to understand the delicate balance between employee rights and responsibilities within the healthcare setting, especially in the histotechnology laboratory. Employee rights are fundamental protections that ensure fairness, respect for conscience, workplace safety, and the ability to advocate without fear of retaliation. These rights create an environment where your concerns and ethical judgments can be voiced openly, fostering a culture of trust and accountability. For example, if you identify a safety hazard or a potential quality control issue with specimen handling, your right to speak up protects you from unfair treatment or dismissal. However, these rights come hand in hand with important responsibilities. As a histotechnologist, you are entrusted not only with technical tasks but also with ethical duties that safeguard patients, co-workers, and the integrity of your institution. This means adhering strictly to safety protocols, maintaining accurate and thorough documentation, and reporting any concerns about patient safety or workplace misconduct promptly and appropriately. Your role is critical in preventing errors that could compromise patient care, such as specimen mislabeling or improper processing, which could lead to misdiagnosis or delayed treatment. The most effective professional environments are those that encourage open communication and make it safe for employees to raise concerns without fear. This kind of culture supports collaboration and continuous improvement, which ultimately benefits everyone involved: the patients who depend on accurate laboratory results, the professionals who rely on each other's integrity, and the healthcare system as a whole. Recognizing that every step you take in the lab carries ethical weight helps you appreciate the broader impact of your work beyond the microscope. By embracing both your rights and your responsibilities, you contribute to a healthy, ethical workplace culture that upholds patient safety and professional integrity. This balance is not just a legal or institutional requirement, it is the foundation of trustworthy healthcare practice and the hallmark of a committed histotechnology professional. Patient abuse stands as one of the most serious and complex challenges facing healthcare today. At its essence, patient abuse involves the mistreatment or neglect of individuals who are especially vulnerable due to factors like age, illness, or disability. This vulnerability places a heightened responsibility on all healthcare professionals, including histotechnologists, to remain vigilant and informed. Abuse can occur in a wide range of environments, from hospitals and nursing homes to outpatient clinics and even within patients' own homes, making it a pervasive issue that extends beyond direct patient care settings. Understanding the various forms of patient abuse is critical. Physical abuse manifests as intentional bodily harm, including bruises, burns, fractures, or other injuries. Psychological abuse, though less visible, can be equally damaging. It includes verbal assaults, threats, intimidation, or other behaviors that undermine a patient's mental and emotional well-being. Medical abuse involves inappropriate or unnecessary treatments or the withholding of necessary care, which can severely impact patient outcomes. Financial abuse exploits a patient's resources or assets, often targeting those who cannot advocate for themselves. Sexual abuse encompasses any non-consensual sexual contact, while neglect refers to the failure to provide essential needs such as food, shelter, hygiene, or medical attention. These categories frequently overlap, complicating detection and intervention. One of the greatest challenges in addressing patient abuse is its subtlety. Injuries or symptoms may be misattributed to accidental causes or natural disease progression. For example, a bruise could result from a fall or from physical abuse, making it difficult to distinguish without careful assessment. Although histotechnologists do not diagnose abuse, our role in processing specimens and reviewing patient histories can indirectly reveal signs of mistreatment. Accurate documentation and attention to unusual findings in tissue samples or clinical information can support healthcare providers in identifying potential abuse. For instance, unexpected tissue damage or evidence of repeated trauma may prompt further investigation. Recognizing and responding to patient abuse is not merely a clinical or legal obligation, it is a profound ethical responsibility. Vulnerable patients depend on healthcare professionals to safeguard their dignity, safety, and rights. As future histotechnologists, your awareness of the core problem of patient abuse equips you to contribute meaningfully to patient protection, ensuring that your work upholds the highest standards of ethical practice within the healthcare system. Certain patient populations are inherently more vulnerable to abuse and neglect, and this vulnerability fundamentally changes the ethical and professional responsibilities of healthcare workers, including those in the histotechnology laboratory. Groups such as children, older adults, individuals with disabilities, and patients with cognitive impairments often cannot protect themselves or effectively communicate experiences of mistreatment. This heightened risk requires all healthcare professionals to exercise increased vigilance and a proactive stance in safeguarding these patients. Dependency plays a crucial role in complicating abuse reporting. Many vulnerable individuals rely heavily on caregivers for their daily needs, which can create fear of retaliation or loss of essential support if abuse is disclosed. This fear often silences victims, making it even more important for healthcare workers to be alert to subtle signs of abuse or neglect. In the laboratory setting, histotechnologists may not interact directly with patients, but they can still encounter indicators such as inconsistent clinical histories, unexplained injuries documented in requisitions, or discrepancies in specimen labeling that raise concerns. Recognizing these red flags imposes an ethical duty to act, as healthcare professionals may be among the few who notice these warning signs. When patients cannot advocate for themselves, the responsibility to protect and speak on their behalf intensifies. Ethical principles like beneficence, promoting the patient's well-being, and non-maleficence, avoiding harm, guide healthcare workers to intervene when abuse is suspected. For histotechnologists, this means maintaining rigorous attention to detail in specimen handling, documentation, and chain of custody procedures. Accurate records can become vital evidence in investigations of abuse or neglect. Additionally, understanding institutional protocols for reporting suspected abuse ensures that concerns are directed through appropriate channels, safeguarding patient welfare while complying with legal mandates. Ultimately, recognizing patient vulnerability transforms professional duties from routine technical tasks into active guardianship. It demands a commitment that extends beyond technical skill to include ethical awareness, courage, and readiness to intervene. In this way, histotechnologists contribute to a healthcare environment that prioritizes patient safety and dignity, reinforcing the broader mission to protect those who cannot protect themselves. Child abuse is a multifaceted and broadly defined concept that extends far beyond the common perception of physical violence. It includes not only physical injury but also emotional harm, sexual abuse, exploitation, neglect, and other forms of maltreatment that can seriously impact a child's well-being. This broad scope is essential because harm to children can occur in many ways, not only through direct acts of violence but also through deprivation, psychological trauma, or failure to provide necessary care. For histotechnologists, understanding this wide-ranging definition is crucial because the tissue samples we process and analyze may sometimes reveal evidence consistent with abuse or neglect. For example, certain patterns of injury or disease identified in pathology specimens might raise concerns about non-accidental trauma or chronic neglect, which could be critical in a multidisciplinary investigation. It's important to recognize that definitions of child abuse vary by state and jurisdiction, which influences how suspected cases are identified, reported, and managed. Some states emphasize physical injuries more explicitly, while others include emotional abuse or neglect as primary concerns. Despite these differences, the common goal across all jurisdictions is to protect children from serious harm or risk of harm, even before actual injury occurs. This preventative approach is key to early intervention, which can stop abuse from escalating and reduce the long-term physical and psychological consequences for the child. Healthcare professionals, including histotechnologists, are often designated as mandated reporters. This legal status means they are required by law to report any reasonable suspicion of child abuse or neglect. Importantly, mandated reporters do not need definitive proof or absolute certainty before making a report. A reasonable suspicion based on clinical or laboratory findings is sufficient. This lower threshold encourages timely reporting so that investigations can begin promptly, potentially preventing further harm. For those working in the laboratory, this means that if you observe unusual or suspicious findings, such as unexplained fractures, bruising patterns, or signs of malnutrition documented in pathology reports, it is your responsibility to communicate these concerns through the proper channels, even if you are not directly involved in patient care. By appreciating the broad and sometimes variable definitions of child abuse, histotechnology students can better understand their role within the larger healthcare team dedicated to protecting vulnerable patients. This awareness ensures that professional actions align with both legal mandates and ethical standards, reinforcing the commitment to safeguard children and support multidisciplinary efforts to identify and prevent abuse. Child maltreatment remains a pervasive and deeply troubling issue despite decades of efforts aimed at prevention and intervention. National statistics consistently identify neglect as the most commonly reported form of child maltreatment. Neglect refers to the failure to meet a child's basic needs, including adequate food, safe shelter, necessary medical care, and appropriate supervision. Unlike physical or sexual abuse, neglect can be less obvious because it often lacks visible signs, yet its impact on a child's physical, emotional, and cognitive development can be profound and long-lasting. In many cases, neglect leads to chronic health problems, developmental delays, and increased vulnerability to other forms of abuse. Physical and sexual abuse continue to pose serious risks to children's safety and well-being. These types of abuse often result in injuries or trauma that require medical evaluation and sometimes forensic investigation. In the histotechnology laboratory, professionals may encounter specimens such as biopsies or autopsy tissues related to these cases. The careful processing, labeling, and documentation of these specimens are critical because they can provide essential evidence in legal proceedings or child protection investigations. Maintaining the chain of custody and ensuring specimen integrity are ethical and legal responsibilities that directly impact the outcome of abuse cases. Tragically, fatalities from child maltreatment still occur, underscoring the limitations of current protective systems. Despite mandatory reporting laws and child protective services, early identification and intervention remain challenging. The COVID-19 pandemic further complicated detection efforts. Social distancing and reduced in-person interactions with teachers, healthcare providers, and community members decreased opportunities for abuse to be observed and reported. Although data from this period are incomplete and complex, there is concern that many cases went unreported, highlighting the need for heightened vigilance as normal social interactions resume. For histotechnologists, understanding the ongoing prevalence and complexity of child maltreatment reinforces the importance of professional diligence. Your role extends beyond technical specimen handling. It includes contributing to a multidisciplinary effort to protect vulnerable patients. Accurate laboratory work, thorough documentation, and clear communication with clinical teams are vital components of this effort. By recognizing the signs of abuse in specimens and maintaining rigorous standards, laboratory professionals play an essential part in safeguarding children's health and supporting justice. Mandated reporting is a fundamental legal obligation designed to protect vulnerable populations, especially children, from abuse and neglect. In healthcare, this duty extends beyond physicians and nurses to include all professionals who may encounter signs of abuse, even indirectly, such as histotechnologists. Although histotechnologists primarily work in laboratory settings, they handle patient specimens and clinical information that may reveal evidence of abuse or neglect. Recognizing and reporting these suspicions is not optional. It is a legal requirement intended to prompt timely intervention by appropriate authorities. The mandated reporting process typically involves two critical steps. First, there is an immediate oral notification to a designated agency, such as Child Protective Services or Adult Protective Services, depending on the situation. This quick communication ensures that concerns are flagged without delay. Following this, a detailed written report must be submitted, documenting the observations and any relevant information. This written record is essential for thorough investigation and legal proceedings. It is important to understand that the exact procedures, timelines, and forms for reporting vary by state, so healthcare professionals, including histotechnologists, must be familiar with the laws and protocols in their jurisdiction. Failure to comply with mandated reporting laws can lead to serious consequences. Civil liabilities may include lawsuits for negligence if harm results from a failure to report. Criminal penalties can range from fines to imprisonment, underscoring the gravity of this responsibility. Beyond legal repercussions, mandated reporting serves an ethical purpose by protecting patients from ongoing harm and supporting their safety and well-being. For healthcare workers, fulfilling this duty also provides legal protection by demonstrating adherence to professional and statutory standards. For histotechnologists, understanding mandated reporting empowers them to act confidently when confronted with potential abuse. For example, if a tissue specimen or clinical history suggests trauma inconsistent with the reported cause, or if documentation raises concerns about neglect, the histotechnologist has a responsibility to escalate those concerns appropriately. This shared responsibility across healthcare disciplines helps create a safety net for vulnerable patients, reinforcing that protecting those at risk is a collective duty, not limited to direct patient care providers. Good faith reporting is a fundamental legal and ethical principle designed to protect healthcare professionals who report suspected abuse, provided they do so with a reasonable belief that abuse may be occurring. This protection is critical because it encourages timely reporting without fear of retaliation or legal consequences. In the laboratory setting, histotechnologists may not directly witness abuse, but they often handle specimens or documentation that could reveal signs of mistreatment or neglect. Understanding good faith reporting empowers you to fulfill your professional responsibilities by recognizing when concerns warrant escalation. When a report is made in good faith, even if later investigations do not confirm the suspicion, the reporter is generally shielded from civil or criminal liability. This legal immunity reflects society's prioritization of protecting vulnerable individuals, such as children, elders, or incapacitated patients, over the risk of false alarms. It encourages healthcare workers to act cautiously and responsibly rather than remain silent out of fear of being sued or disciplined. For example, if a histotechnologist notices unusual tissue patterns or documentation inconsistencies that raise concerns about possible abuse, reporting these observations promptly and accurately can initiate protective interventions. However, it is equally important to distinguish good faith reporting from bad faith reporting. Bad faith reporting involves knowingly making false accusations or filing reports without a reasonable basis, which can cause significant harm to individuals and families, damage professional reputations, and result in legal penalties. Healthcare professionals must therefore base their suspicions on objective observations, supported by clear documentation. In the laboratory, this means carefully recording any unusual findings, maintaining specimen integrity, and communicating concerns through proper channels without speculation or bias. For histotechnologists, maintaining professional integrity means balancing vigilance with responsibility. By understanding the legal protections and ethical duties tied to good faith reporting, you contribute not only to patient safety, but also to your own legal and professional security. This knowledge reinforces the broader commitment of healthcare professionals to protect patients, uphold trust, and foster a culture where concerns can be raised safely and constructively. Detecting abuse in any patient population, whether children, adults, or the elderly, requires a mindset focused on identifying patterns rather than isolated incidents. Abuse rarely presents as a single, stand-alone event. Instead, it often manifests through a combination of physical signs, behavioral changes, and contextual inconsistencies that, when viewed collectively, raise concern. Physical indicators might include unexplained bruises, burns, fractures, or other injuries that do not align with the reported cause. Behavioral clues such as withdrawal, sudden aggression, fearfulness, or neglect of personal hygiene can also signal underlying abuse. Additionally, inconsistencies in the patient's history or the environment, like frequent missed appointments, delayed treatment, or a caregiver's evasiveness, may provide important context. For histotechnologists, this pattern-based approach is crucial because the specimens we process can sometimes reveal evidence of trauma or neglect that might otherwise go unnoticed. For example, repeated fractures or tissue damage visible under the microscope could suggest chronic injury rather than a single accidental event. While we do not diagnose abuse, recognizing when tissue findings are inconsistent with the clinical history or when there is evidence of repeated injury can prompt further inquiry by the clinical team. This requires careful attention to detail and a willingness to consider the broader clinical picture. At the same time, it is essential to apply differential diagnosis rigorously. Not every bruise, fracture, or tissue abnormality results from abuse. Medical conditions such as bleeding disorders, brittle bone disease, or certain dermatological conditions can mimic signs of trauma. Accidental injuries and medical treatments may also produce findings that resemble abuse. The key question is whether the explanation provided fits the evidence logically and consistently. When discrepancies arise, such as a fracture pattern that does not match the reported mechanism of injury, this should raise a red flag. In the laboratory setting, your role extends beyond specimen preparation to include meticulous documentation and clear communication. If you observe unusual or suspicious findings in tissue samples, it is your responsibility to report these observations to the appropriate clinical personnel promptly. This ensures that potential abuse is not overlooked due to fragmented or incomplete information. Pattern thinking encourages a holistic view, integrating physical findings, patient history, and laboratory data to protect vulnerable patients effectively. Ultimately, detecting abuse demands vigilance, critical thinking, and ethical courage. By questioning explanations that do not align with the evidence and collaborating with the healthcare team, histotechnologists contribute to safeguarding patient welfare and upholding the highest professional standards in both the laboratory and clinical environments. Let's examine a real-world case that underscores the critical importance of careful assessment and respectful persistence when abuse is suspected. In this instance, a resident physician encountered a child with a fractured femur. The explanation provided was that the injury resulted from the child tripping over a toy. However, the resident's clinical judgment raised concerns because the nature of the fracture did not align with what would typically be expected from such a minor accident, especially considering the child's developmental abilities and mobility at that age. To gain further clarity, radiologists were consulted. Their expertise was pivotal. They analyzed the fracture pattern and concluded that it was unlikely to have been caused by a simple trip and fall. This objective, specialized input challenged the initial story and prompted a deeper investigation. The involvement of social services followed, revealing that the child was already part of an active child welfare case, which added a layer of urgency and context to the situation. This sequence highlights the vital role of interdisciplinary communication among healthcare providers, radiologists, social workers, and laboratory professionals in protecting vulnerable patients. For histotechnologists, this case carries important lessons. While you may not be directly involved in diagnosing fractures, your role in preparing and examining tissue samples can provide crucial evidence that supports or refutes suspicions of abuse. For example, when bone biopsies or tissue specimens show signs of healing fractures or repeated trauma, these findings can corroborate concerns raised by clinicians and radiologists. Accurate documentation and meticulous slide preparation ensure that this evidence is reliable and can withstand legal and clinical scrutiny. The key takeaway is the power of respectful persistence, continuously asking questions, seeking second opinions, and collaborating across disciplines. This approach can be life-saving because it prevents suspicious injuries from being dismissed prematurely. In the laboratory, your commitment to accuracy, attention to detail, and ethical responsibility forms an essential part of the broader safety net that protects patients. By maintaining professional vigilance and open communication, histotechnologists contribute meaningfully to the detection and prevention of abuse, reinforcing the healthcare system's duty to safeguard those who cannot protect themselves. Elder abuse is a deeply complex issue that encompasses far more than just physical harm. It includes a range of harmful behaviors such as physical, sexual, emotional, and financial abuse, as well as neglect, abandonment, and even self-neglect. Many older adults are particularly vulnerable because they often rely heavily on caregivers for daily needs, may experience social isolation, and sometimes feel ashamed or fearful about reporting abuse. This fear can stem from concerns about retaliation, loss of independence, or not being believed. As a result, elder abuse is frequently underreported, making it a hidden epidemic within healthcare settings. From the perspective of histotechnology, understanding the various forms of elder abuse is crucial. Although histotechnologists do not provide direct patient care, the specimens and tissue samples we handle can sometimes reveal signs of abuse or neglect. For example, unexplained bruises, pressure ulcers, or fractures found in elderly patients may raise red flags, especially if the clinical history is unclear or inconsistent. However, it is important to approach these findings with caution, as older adults often have more fragile skin and bones due to aging or underlying medical conditions, which can complicate the interpretation of such injuries. Respecting the dignity and rights of older adults is fundamental in all healthcare roles, including the laboratory. Older patients deserve to be treated with compassion and respect, regardless of their physical or cognitive abilities. In the laboratory setting, this means maintaining strict confidentiality of patient information, ensuring accurate and thorough documentation, and collaborating with clinical teams to help identify potential abuse. Your role in processing and analyzing specimens contributes to a broader system of care that can detect elder abuse early and help intervene before it escalates. Ultimately, elder abuse is not only a medical or legal concern, but also a profound ethical issue. As future histotechnologists, your awareness and vigilance can make a meaningful difference in safeguarding the well-being of older adults. By recognizing the signs, maintaining professional integrity, and supporting multidisciplinary efforts, you help ensure that elderly patients receive the care, protection, and respect they deserve. Physical abuse in older adults requires a nuanced and careful approach because the clinical picture can be complex. Many elderly patients have underlying medical conditions such as osteoporosis, which weakens bones and makes them more susceptible to fractures from relatively minor trauma. This fragility means that injuries commonly seen in abuse cases, like bruises, fractures, or skin tears, may also occur from accidental falls or routine care activities. As a result, healthcare professionals, including histotechnologists, must exercise careful clinical judgment when evaluating specimens or documentation related to suspected abuse. In the histology laboratory, your role is critical in supporting accurate diagnosis and legal investigations. Proper specimen handling, meticulous labeling, and thorough documentation are essential to preserve the integrity of potential evidence. Photographs of injuries, detailed descriptions, and timelines recorded by clinicians help build a comprehensive clinical picture, but the laboratory's contribution ensures that tissue samples are correctly processed and linked to the patient's case. This precision helps clinicians differentiate between injuries caused by abuse and those resulting from medical fragility or accidental trauma. It is important to avoid two common pitfalls. On one hand, dismissing injuries as simply the result of aging or frailty can leave vulnerable patients unprotected and allow abuse to continue unchecked. On the other hand, making unsupported accusations of abuse can cause significant harm, including damage to the patient's relationships, reputations, and emotional well-being. A balanced, evidence-based approach is necessary, one that integrates clinical findings, laboratory results, and thorough investigation. This approach respects the dignity and rights of the patient while ensuring their safety. By understanding these complexities, histotechnologists contribute meaningfully to a multidisciplinary effort to protect older adults from abuse. Your attention to detail, ethical responsibility, and commitment to accurate documentation not only support patient care, but also uphold legal and professional standards. Recognizing the subtle distinctions in injury patterns and maintaining rigorous laboratory practices are key components in safeguarding vulnerable populations and ensuring justice is served. Sexual abuse of elders is a profoundly serious and often hidden form of mistreatment that demands our full attention as healthcare professionals. Unlike other types of abuse, sexual abuse is frequently concealed due to the victim's feelings of shame, fear, or confusion. Cognitive impairments such as dementia or physical disabilities can make it even harder for victims to report or even recognize the abuse. This creates a significant challenge for detection and intervention, especially since perpetrators are often individuals in positions of trust, caregivers, healthcare staff, or facility employees. This dynamic complicates reporting because victims may fear retaliation or not be believed, and staff may be hesitant to report colleagues. Healthcare organizations, therefore, have a critical responsibility to establish robust prevention strategies, clear reporting protocols, and supportive environments that encourage vigilance and transparency. For histotechnologists, understanding the realities of elder sexual abuse is important because tissue samples may be collected as part of forensic investigations. When sexual abuse is suspected, specimens such as biopsies, swabs, or other tissue samples can provide crucial evidence. It is essential that these samples are collected, handled, and documented meticulously to preserve their integrity for legal proceedings. Even though histotechnologists may not be involved in the initial collection, the way specimens are processed and stored in the lab can directly impact the ability to confirm abuse or support victim protection. Maintaining a chain of custody, accurate labeling, and thorough documentation are vital responsibilities that contribute to justice and patient safety. Healthcare organizations must foster a culture of safety through ongoing education and training that helps staff recognize subtle signs of sexual abuse, such as unexplained injuries, behavioral changes, or withdrawal. Clear, accessible reporting mechanisms must be in place, ensuring that allegations are taken seriously and investigated promptly. The laboratory's role is to provide reliable diagnostic support that can corroborate clinical findings or raise red flags when abuse is suspected. This multidisciplinary approach, combining clinical vigilance, forensic expertise, and laboratory accuracy, is essential to protect vulnerable elders from harm. Ultimately, addressing sexual abuse in elder populations requires sensitivity, professionalism, and a steadfast commitment to ethical practice. As histotechnologists, your work supports this mission by upholding the highest standards in specimen handling and documentation, thereby playing an integral role in multidisciplinary efforts to safeguard patient dignity and well-being. Your attention to detail and ethical responsibility contribute directly to the broader healthcare goal of preventing abuse and ensuring justice for those who cannot protect themselves. Emotional abuse, while often less visible than physical or sexual abuse, can cause deep and lasting harm to an individual's dignity and overall well-being. This form of abuse includes behaviors such as name-calling, scapegoating, humiliation, threats, isolation, or restricting a person's freedom. These actions attack the core of a person's self-worth and identity, leading to emotional distress that may manifest as withdrawal, depression, anxiety, fear, or social isolation. For vulnerable populations, including older adults and patients with disabilities, emotional abuse can be as damaging as physical injury, impacting their mental health and quality of life in profound ways. One of the challenges in addressing emotional abuse is that it rarely leaves physical evidence, making it harder to detect and prove. However, changes in a person's behavior, mood, or social interactions often serve as important warning signs. In the laboratory setting, histotechnologists may not directly witness these signs, but it is crucial to recognize that your professional conduct contributes to the environment in which patients and colleagues feel respected and safe. Upholding ethical standards, such as maintaining confidentiality, communicating with empathy, and treating everyone with dignity, helps create a culture that discourages emotional abuse and supports those who may be vulnerable. Respectful behavior and ethical professionalism are fundamental protective measures against emotional abuse. When you treat patients and coworkers with kindness and fairness, you help preserve their dignity and foster trust. This is especially important in histotechnology, where your work with patient specimens and data requires careful attention to accuracy and confidentiality. Your role is part of a larger healthcare system that must be vigilant not only about physical safety, but also about emotional and psychological well-being. Recognizing the impact of emotional abuse and committing to respectful practice aligns with the ethical principles of beneficence and non-maleficence, which guide all healthcare professionals. By understanding the subtle yet serious effects of emotional abuse, histotechnologists contribute to the broader mission of healthcare, to protect and promote the humanity of every patient. This commitment is not only an ethical obligation but also a legal responsibility, as many jurisdictions mandate reporting suspected abuse, including emotional harm. Your awareness and professional integrity help ensure that all forms of abuse are acknowledged and addressed, supporting a safer and more compassionate healthcare environment. When we consider harm to older adults, the first images that often come to mind are physical injuries or neglect. However, financial exploitation represents a significant and often overlooked form of health-related harm that can deeply affect an individual's overall well-being. Financial abuse can manifest in many ways, such as theft of money or property, coercion to sign documents against one's will, deceptive scams, identity theft, or unauthorized use of assets. These actions can rapidly deplete an older adult's financial resources, leaving them unable to afford essential medical care, necessary medications, or even basic needs like food and housing. This deprivation directly impacts their health, increasing vulnerability to illness and complicating treatment outcomes. It's important to recognize that perpetrators of financial exploitation are not always strangers or criminals operating from outside the family circle. Often, trusted individuals, family members, caregivers, or even healthcare aides may abuse their position of trust to take advantage of vulnerable seniors. In other cases, criminals exploit technology, targeting older adults through phone calls, emails, or online scams, knowing that seniors may be less familiar with digital security or more trusting by nature. This form of abuse is particularly insidious because it can remain hidden for long periods. Many victims do not report financial exploitation due to feelings of shame, fear of losing independence, or concern about causing family conflict. This silence allows the abuse to continue unchecked, further endangering the victim's health and safety. From the perspective of histotechnology and laboratory practice, understanding the broader context of patient care is essential. Financial exploitation can lead to increased stress, anxiety, and depression, all of which affect physiological health and may influence disease progression. For example, a patient who cannot afford prescribed medications may experience worsening symptoms or complications, which in turn can affect biopsy results or tissue quality. This underscores the importance of viewing patient care holistically, recognizing that social and financial factors are integral to health outcomes. As histotechnologists, while our primary focus is on specimen preparation and analysis, awareness of these external factors can enhance our appreciation of the patient's condition and the challenges they face. In summary, financial exploitation is not merely a legal or social issue. It is a serious health concern that can accelerate physical and mental decline in older adults. As future professionals in the laboratory setting, cultivating awareness of these issues fosters a more compassionate, ethical, and comprehensive approach to patient care. It also encourages collaboration with healthcare teams to support vulnerable patients beyond the microscope, ensuring that their dignity and well-being are protected in all aspects of care. Neglect is a critical form of elder abuse that can manifest in two primary ways: active and passive. Active neglect involves deliberate actions that withhold essential care or resources, such as intentionally denying food, medication, or assistance needed for daily living. This type of neglect is a willful failure to meet the basic needs of an older adult and can lead to serious physical and emotional harm. Passive neglect, on the other hand, is often unintentional. It occurs when caregivers fail to recognize or respond adequately to the needs of an elderly person due to ignorance, lack of training, or insufficient resources. Although passive neglect may not involve malicious intent, its consequences can be just as severe, resulting in malnutrition, dehydration, infections, pressure ulcers, or exacerbation of chronic illnesses. A specific form of neglect is abandonment, where a caregiver deserts the older adult, leaving them without necessary supervision or support. This situation is particularly dangerous for individuals with cognitive impairments, such as dementia, or those with limited mobility, as they may be unable to seek help or care for themselves. Another related concern is self-neglect, which occurs when an older adult fails to provide adequate care for themselves. Self-neglect can stem from mental health disorders, cognitive decline, or physical disabilities and may present as poor hygiene, unsafe living conditions, or refusal of medical treatment. While self-neglect is distinct from caregiver neglect, it still requires attention and intervention to protect the individual's well-being. Preventing neglect demands vigilance from all healthcare professionals, including those working in histotechnology. Although histotechnologists do not provide direct patient care, they play a vital role in the healthcare system by analyzing tissue specimens that may reflect underlying neglect. For example, tissue samples showing untreated infections, chronic wounds, or malnutrition-related changes can offer clues about a patient's living conditions and care quality. Recognizing these signs in clinical histories or specimen pathology helps laboratory professionals understand the broader context of patient health and supports interdisciplinary communication. Healthcare workers have a legal and ethical responsibility to report suspected neglect to appropriate authorities. Timely reporting can prevent further harm and ensure that vulnerable older adults receive the care and protection they need. Documentation is equally important. Accurate records of observations and communications help establish a clear account of suspected neglect and support any necessary investigations. Ultimately, addressing neglect requires a balance between protecting patient safety and respecting the dignity and autonomy of older adults, emphasizing compassionate, patient-centered care across all healthcare settings. Nursing homes and long-term care facilities are entrusted with the care of some of the most vulnerable individuals in our society, often older adults with complex medical conditions and limited ability to advocate for themselves. These settings are intended to provide safety, comfort, and medical support, yet unfortunately, abuse and neglect remain persistent and troubling issues despite the existence of regulations and routine inspections. When caregivers or institutions fail in their duty, it constitutes a profound betrayal of trust that can lead to serious physical injuries, emotional trauma, and even premature death among residents. Regulatory bodies such as state health departments and the Centers for Medicare and Medicaid Services conduct regular surveys and inspections to assess the quality of care in these facilities. However, abuse is frequently underreported. Residents may fear retaliation, loss of services, or social isolation if they speak out. Additionally, families and oversight agencies often rely on quality ratings that can be misleading due to incomplete data or overly optimistic reporting by facilities. One critical indicator of systemic problems is poor infection control. Inadequate infection prevention not only causes outbreaks of serious illnesses but also signals deeper issues such as insufficient staff training, lack of proper supervision, and inadequate resource allocation. These deficiencies reflect a broader failure to meet basic standards of care. For histotechnologists, the connection to abuse in care facilities might not be immediately obvious, but it is significant. Tissue specimens from residents may reveal signs of chronic infection, pressure ulcers, or other injuries consistent with neglect or abuse. Understanding the patient's living environment and clinical background can be crucial when communicating with clinicians and pathologists. This context helps ensure that diagnoses consider potential underlying causes related to abuse or neglect, which can influence treatment decisions and legal reporting obligations. Ultimately, abuse in care facilities represents a violation of both ethical and legal responsibilities. As future professionals in the healthcare system, it is essential to remain vigilant and advocate for patient safety and dignity. Adhering to quality standards, recognizing warning signs, and understanding mandatory reporting requirements are all part of our role in protecting vulnerable populations. This awareness reinforces the broader principle that every healthcare worker, including those in the laboratory, shares responsibility for upholding the trust placed in the healthcare system. Reporting elder abuse presents unique challenges that differ significantly from other types of abuse. Healthcare professionals, including those in laboratory settings, are often legally mandated reporters, meaning they must report any reasonable suspicion of elder abuse. This legal requirement acknowledges the particular vulnerability of seniors, who may face physical, emotional, or financial harm. However, despite these mandates, reporting elder abuse is frequently more difficult in practice. One reason is that seniors themselves may be hesitant or fearful to disclose abuse. They might worry about retaliation from the abuser, who is often a family member or caregiver, or fear being placed in an institution against their wishes. Additionally, many elders may feel shame or guilt about exposing family members, or they may have a deep emotional attachment that complicates their willingness to report mistreatment. Women and individuals over the age of 75 are especially at risk, and they often encounter additional barriers to reporting abuse. The fact that most perpetrators are relatives creates a complex emotional and social dynamic. Victims may feel dependent on their abusers for daily care, financial support, or companionship, which can lead to feelings of loyalty or fear that prevent them from seeking help. This dynamic can make it challenging for healthcare workers to identify abuse, as signs may be subtle or masked by the victim's reluctance to speak out. For histotechnologists, while direct interaction with patients is limited, awareness of elder abuse and its reporting challenges remains important. You may come across clinical histories, specimen labels, or documentation that hint at neglect or abuse, such as unexplained injuries, inconsistent medical histories, or signs of poor hygiene. Understanding the legal responsibilities around reporting and the emotional complexities victims face helps you contribute to a culture of vigilance and support within the healthcare team. Promptly communicating concerns through appropriate channels can facilitate timely intervention and protect vulnerable seniors. Creating an environment that encourages openness and attentiveness in both laboratory and clinical settings is essential. Reporting suspected elder abuse is not merely a legal duty, it is a moral obligation that underscores the commitment of every healthcare professional to patient safety and dignity. By recognizing the difficulties victims face and the importance of reporting, histotechnologists play an integral role in safeguarding the well-being of older adults. Accurate and objective documentation is a fundamental responsibility in healthcare, especially when abuse or neglect is suspected. It is crucial that any notes or records reflect clear, factual observations rather than subjective opinions or assumptions. For example, rather than writing "patient is abusive," which is a judgmental label, it is far more appropriate to document specific behaviors such as patient shouted at staff and refused medication. This approach ensures the documentation remains impartial and credible, which is essential when these records may be used to support protective interventions, investigations, or legal proceedings. Including detailed information is equally important. This means noting the exact time and location of observations, precise statements made by the patient or others, thorough descriptions of any injuries or symptoms, and the actions taken in response. Such comprehensive documentation creates a reliable and complete picture of the situation, which can be invaluable during investigations or court cases. Avoiding speculation or personal judgment helps maintain the integrity of the record, ensuring it can withstand scrutiny and serve its intended purpose effectively. In the context of histotechnology, although laboratory personnel may not interact directly with patients, the principle of objective documentation still applies. Histotechnologists must maintain meticulous records regarding specimen conditions, labeling accuracy, and any unusual findings observed during tissue processing. For instance, if a tissue sample displays signs consistent with trauma or neglect, documenting these observations clearly and factually can provide critical information for clinicians and contribute to patient safety. This documentation becomes part of the overall healthcare record, supporting accurate diagnosis and treatment decisions. Ultimately, good documentation is a cornerstone of ethical practice in healthcare. It protects patients by ensuring concerns are clearly communicated and addressed, supports healthcare providers by providing a defensible record of their observations and actions, and upholds the integrity of medical and legal processes related to abuse and neglect. For histotechnologists and laboratory professionals, maintaining objective, detailed, and accurate documentation is not only a professional obligation, but also a vital contribution to patient care and safety. When surveyors inspect care facilities, their goal is to identify any signs of abuse or neglect that could compromise patient safety and dignity. One critical area they scrutinize is the use of restraints. Restraints must always be authorized by a qualified healthcare professional, applied only for the minimum necessary duration, and accompanied by continuous monitoring to prevent physical or psychological harm. Improper or excessive use of restraints is considered a form of abuse and can lead to serious injury, emotional trauma, or even death. Surveyors carefully review restraint orders, the documentation of their use, and the frequency of resident checks to ensure compliance with regulations and ethical standards. Beyond restraints, surveyors look for other indicators that may signal abuse or neglect. These include overmedication, which can mask symptoms or incapacitate residents, unexplained bruises or injuries that do not align with the resident's medical history, and visible signs of fear or anxiety around staff members. Neglect may manifest as poor hygiene, malnutrition, dehydration, or untreated medical conditions. Emotional abuse, though harder to detect, may be inferred from behavior such as withdrawal, humiliation, or sudden changes in mood. Surveyors also observe the interactions between residents and staff to assess whether residents appear comfortable, respected, and safe. Positive, respectful relationships are a strong indicator of quality care and a protective factor against abuse. Although histotechnologists typically do not have direct contact with patients, they play an essential role in maintaining a culture of vigilance. Unusual clinical information, such as unexpected tissue changes, discrepancies in specimen labeling, or abnormalities in laboratory data, may raise concerns that warrant further investigation. Promptly communicating these concerns through appropriate channels helps ensure that potential abuse is identified and addressed early. Documentation is key. Accurate, timely records support investigations and protect both patients and healthcare workers. Ultimately, surveyors rely on detailed observation and collaboration among all healthcare professionals to detect abuse. Understanding what surveyors look for helps histotechnology students appreciate their ethical responsibilities within the broader healthcare system. Professionalism, attention to detail, and a commitment to patient safety are vital in every role, reinforcing the importance of ethical vigilance even when working behind the scenes in the laboratory. In this case, the facility's leadership was fully aware of hazardous and unsanitary conditions affecting residents but failed to take meaningful action to correct them. This failure resulted in residents suffering from unsafe practices, inadequate supervision, and substandard care. Legally and ethically, this situation exemplifies wanton neglect, where those in positions of authority consciously disregard the well-being of vulnerable individuals under their care. It is important to understand that leadership cannot simply claim ignorance or distance themselves from harm that occurs under their watch. Even if administrators or managers did not personally create every unsafe condition, they bear responsibility for allowing those conditions to persist unchecked. From a legal perspective, wanton neglect is a serious violation because it involves a deliberate or reckless disregard for the safety and dignity of residents, who are often elderly or otherwise vulnerable. Ethically, leaders have a fundamental duty of care to ensure that the environment is safe and that residents receive proper supervision and treatment. This duty extends beyond direct care providers to include all levels of management. Delegating responsibility without adequate oversight is insufficient and can lead to systemic failures that harm patients. For histotechnologists and other laboratory professionals, this case highlights a broader principle. Every member of the healthcare team, regardless of their direct patient contact, shares responsibility for patient safety and ethical practice. Although you may not provide bedside care, your work in processing specimens, maintaining documentation, and ensuring laboratory safety directly impacts patient outcomes. If you observe unsafe or unethical practices, whether in the laboratory or in the clinical environment, it is your professional and ethical obligation to report and address these concerns. Maintaining the highest standards in the laboratory helps prevent harm and supports the overall integrity of patient care. This case reinforces why leadership accountability is both a legal and ethical imperative. It reminds us that protecting patients is a shared responsibility that extends beyond those who provide direct care to include everyone involved in the healthcare process, including those working behind the scenes in the histology lab. Understanding this helps us appreciate the importance of vigilance, reporting, and advocacy in promoting a safe and ethical healthcare environment. This case presents some of the most serious ethical and legal challenges that can arise in healthcare settings: abuse, unauthorized searches, and forced medication of residents or patients. Abuse in this context is not limited to physical harm. It can include emotional humiliation, rough or inappropriate handling, and violations of personal privacy, such as conducting searches without proper consent or legal authority. Forced medication without informed consent is a particularly grave violation of patient rights, as it undermines autonomy and can cause harm both physically and psychologically. It is vital to understand that just because certain abusive practices may have become routine or normalized within a facility, this does not make them lawful or ethically acceptable. Routine does not equal right. Healthcare laws and ethical standards mandate that every patient must be treated with dignity, respect, and compassion, regardless of the challenges their condition or behavior might present. Lack of staff training, understaffing, or high-stress environments are never acceptable excuses for abuse or violations of patient rights. Every healthcare professional, including those working behind the scenes in laboratories, has a responsibility to uphold these standards. For histotechnologists, this case underscores the importance of maintaining patient dignity and confidentiality at all times. While you may not be directly involved in administering medication or conducting searches, your role in handling patient specimens and sensitive information carries a significant ethical obligation. Protecting patient privacy, ensuring accurate and honest documentation, and reporting any suspected abuse or violations you observe are essential components of your professional responsibilities. Abuse anywhere in the healthcare system erodes trust and safety, which ultimately affects the entire care team, including laboratory personnel who rely on accurate, ethically obtained specimens and information. This case also highlights the necessity for vigilance and ethical courage. Healthcare professionals must be willing to speak up against abuse and advocate for patient rights, even when it is uncomfortable or risky. By doing so, you help reinforce a culture of respect, lawful care, and safety that benefits patients, co-workers, and the broader healthcare community. Remember, protecting patient rights is not just a bedside issue. It is a responsibility shared by all healthcare workers, including those in the laboratory. Preventing abuse and neglect in healthcare settings requires a comprehensive approach that goes beyond individual good intentions. It demands the establishment of robust systems combined with the cultivation of strong personal character among all healthcare workers. One critical component of these systems is thorough background checks for employees, which help identify individuals who may pose a risk to vulnerable patients, including children, seniors, and those with disabilities. These checks serve as an initial safeguard by screening out those with histories of abuse or other behaviors that could compromise patient safety. Equally important is comprehensive training that equips staff with a clear understanding of legal mandates, ethical standards, and best practices for patient care. Training should cover how to recognize signs of abuse or neglect, the proper channels for reporting concerns, and the ethical responsibilities each employee holds. This education empowers healthcare workers to act confidently and appropriately when they suspect mistreatment. Public education and legal support also play vital roles in prevention. Families and communities need to be informed about the warning signs of abuse and the resources available for reporting and intervention. Families, in particular, are essential partners in prevention by maintaining involvement in their loved one's care and helping to prevent isolation, which often increases vulnerability to abuse. Monitoring financial vulnerability is another key aspect, as exploitation frequently targets patients who have diminished decision-making capacity or limited oversight. For healthcare professionals, including histotechnologists, courage is a fundamental quality. It is not enough to intervene only when abuse is obvious. Early action at the first signs of potential harm is crucial. Waiting until severe injury or neglect occurs can have devastating consequences for the patient and legal repercussions for the institution and individuals involved. Prevention is a multifaceted strategy that combines clear policies, ongoing education, genuine compassion, and accountability mechanisms. Creating a culture where abuse is unequivocally unacceptable and where every employee feels responsible for patient protection is essential. In the histotechnology laboratory, this means adhering strictly to protocols, ensuring accuracy in specimen handling and documentation, and promptly reporting any irregularities or concerns. Your role may be indirect, but it is vital in maintaining the integrity of the healthcare system and safeguarding patient welfare. Understanding prevention as both a systemic obligation and a personal ethical commitment highlights how your actions and the environment you help foster directly impact patient safety and dignity. Prevention is not merely a policy to follow, it is a professional and moral imperative that defines the quality and trustworthiness of healthcare delivery. As we bring HTL 312 to a close, it's crucial to understand that legal compliance represents the baseline, the minimum standard that every healthcare professional, including histotechnologists, must meet. However, ethical professionalism requires us to go beyond simply following laws and regulations. It demands a deeper commitment to integrity, respect for patients, and a focus on patient-centered care. In the laboratory setting, histotechnologists hold a unique and vital responsibility. By ensuring the accuracy of specimen processing, maintaining strict confidentiality of patient information, adhering to safety protocols, and promptly reporting any irregularities or concerns, you are actively protecting patients and contributing to the overall quality of healthcare. When you encounter something that doesn't seem right, whether it's a procedural discrepancy, a safety hazard, or an ethical concern, it's essential to pause and carefully document your observations. Documentation is not just a bureaucratic task, it serves as a critical record that supports patient safety and professional accountability. Following the proper chain of command to escalate issues ensures that concerns are addressed appropriately and in compliance with legal requirements. This process safeguards patients from harm and also protects you as a professional by demonstrating that you acted responsibly and ethically. The laboratory is not an isolated environment separate from patient care. Every specimen you handle, every test result you prepare, and every report you generate directly influences diagnosis and treatment decisions. Errors, breaches of confidentiality, or lapses in safety can have serious consequences for patients and the healthcare team. Upholding ethical standards and legal obligations helps build trust between patients and healthcare providers, supports patient rights, and fosters a culture of safety within the laboratory and the broader healthcare system. In summary, your role as histotechnologists extends well beyond technical expertise. It encompasses a profound ethical responsibility, a thorough awareness of legal requirements, and an unwavering commitment to patient welfare. By carrying these principles forward in your careers, you will not only enhance the quality of laboratory practice, but also make a meaningful difference in the lives of patients and the integrity of the healthcare system as a whole.